Welcome to the Evolve Nurse Podcast. I'm your host, Keish, and I want to say everything is growing, changing, and evolving. Even you, from the student nurse to the baby nurse, the veteran nurse, off the bedside and into entrepreneurship, you have arrived and you have evolved. So, welcome to the Evolve Nurse Podcast. I want to say happy holidays because I miss Thanksgiving, Christmas, Kwanzaa, New Year. We are in the new year, and I hope that your 2025 was great, and I hope that your 2026 is even better. And I also want to ask you, do you require rest? Right? Have you been actually resting? Because I know that if you're here, you are a healthcare provider or you are intending on being a healthcare provider. And that means that you pour into others way more than you pour into yourself. Well, I will be putting on a conference for Black women in healthcare called the Evolve Nurse Summit, Reclaiming Rest and Worth, so that you can understand what it feels like to rest, what it looks like to rest. How can you pour into yourself? Because I went to therapy one time, y'all, and my therapist said that you cannot pour from an empty cup. You can only give them what overflows. So if you have a bottle of water, whatever is overflowing from that, you can give to others. If you don't have it, you don't have it to give. And a lot of us are running on depleted, okay? So I will be making sure that I create a safe space for you all so that you feel like you can rest, so that you can understand what worth looks like. Because if you don't know your worth, honey, I'm telling you now, they will tell you what your worth is and they'll charge you less than that. So let's get right into this episode, y'all. We getting right into it. Okay. So today we're going to be talking about something that's very uncomfortable to talk about, but we got to talk about it, okay? We have to make sure that we are speaking about people who are unteachable, but also nurses who eat their young. And what does that look like? And does it start from the nursing culture? Or is that just a personality trait? Because some of these things are because of the environment that we have, but we have to make sure that we're talking about it. We have to talk about this is not about nursing biases, but it's about healing and accountability and the evolution of nursing. If we're going to forward progress in nursing, we have to make sure that we're talking about the things that are uncomfortable so that we can see progression, forward progression, okay? And so we have to name the reality. The reality is nurses are leaving at a alarming rate. I left the bedside after the vid, okay? After the vid, I was out of there. I was like, I'm seeing too much. I'm going through too much. It's showing me that the hospital doesn't care about their employees. So I had to dip, okay? And when I did that, it made me see things on a larger scale. So I was able to see what type of cultures certain units had. And culture does play a bigger role than we'd like to admit. So if we want to keep nurses, we have to talk about what's pushing them away. And then nurses who eat their young, what does that really mean? We got to get into it. We got to unpack that because guess what? We just have to. So, nurses who eat their young. What is a nurse who eats their young? Nurses who eat their young focus on nurse bullying. It's one of the things that most people outside of the nursing career, they do not know that this happens. These are nurses who have been nurses, they're veteran nurses, been nurses for a long time, and when they have to orient students, they treat them like second-class citizens, right? They drown them, they make them feel bad about themselves, and then they hope and pray that they might leave. And sometimes it's always due to how they were taught too. If somebody else taught them that way and they feel like they are a great nurse, so they do the same thing to other nurses, it happens all the time. So let me get into what I have seen. Now, I didn't let myself become one of the nurses who got ate by their young, okay? I have been bullied by a nurse before, but they did not orient me very long so that they could eat me and spit me out. And actually, I think I was a nurse for longer than that nurse, but I still allowed myself to be teachable by them because I was in a new specialty. But this is what I have seen in the operating room. I have seen nurses get thrown out into the water without a floaty. They just treading water trying to make it through. This is what happens, right? You're circulating the case, you're new here, you don't know what's going on, and all of a sudden you look around and your preceptor is gone. They're going to the Starbucks. They have left you in the room by yourself to fend for yourself with a surgeon who really don't like other people being in the room with them, right? This is what happens, and it happens on a daily basis. And I was actually talking to one of my old coworkers about this, and she was like, but I wouldn't be the nurse who I am today had it not been for them doing that to me. And I was like, you wouldn't be the nurse that you are today. You would be a nurse who doesn't have to function under anxiety all the time. You would be a nurse who understands what they're doing, and they don't have to brace for what's to come. You'll be a nurse who is able to be confident in yourself without all of the extra pressure that's on you, right? These are the things that they put on you when they do the nurses eating their young, when they throw you out to dry, when they throw you into the deep end. When they do all of these things to you, what they end up doing is traumatizing the whole nursing community, because trust me, the operating room, we're traumatized. We're traumatized. Management traumatized, we traumatized, A&M's traumatized, everybody traumatized. They don't know what the surgeon's gonna say, so they scared of the surgeons. They don't know what the people gonna say, so they scared of the people. We're traumatized. And we're traumatized because we allowed nurses to eat their young for way too long. Okay. So common behaviors that nurses eat their young, they bully. And it's disguised as toughening you up, right? If you just toughen you up. Public humiliation, withholding information, gatekeeping knowledge. They're not going to tell you everything that you need to know. They're going to tell you little bits here and there, but they're not going to tell you everything. And these behaviors show up in new grad students, nurses transitioning specialties, emotional and professional impact. This will cause burnout, imposter syndrome, or like I like to say, nurse imposter syndrome, and it causes people to flee the bedside. We're fleeing the bedside. We're leaving the bedside. And I love that nursing has this pivot factor to it. Like I can move and shift when I want to. But we also have to address the facts. The fact is, we're leaving the bedside. And if we don't have anybody at the bedside, who's going to be here to take care of patients? And where's these floaties? But yes, and some people don't want to be in nursing at all. And that's why I created this platform, because I know that sometimes nursing does not work out for us. We can pivot, we can shift, we can go into different specialties, we can start our own businesses. But we have to make sure that we are addressing the issue at hand. The issue at hand is that nurses are being bullied and pushed out of these specialties and pushed out of nursing altogether, because now we feel like we're imposters and now we don't feel like we belong. But I want to tell you now that you do belong, okay? You belong. You belong, honey. All right. So I want to say that if we can look at people who are being hazed and we're saddened by them being hazed, right? We don't want anyone to have to go through physical harm in order to get into an organization. But this is what happens when nurses eat their young. They are hazing you, and it's trauma. It's traumatic. I'm telling you, I was bullied for, I want to say, like almost a year, right? And it was framed in a way where it was like just not talking to me. Every day I would speak, she would not speak to me. Every day I would say something, she would not speak to me. And with me being the operating room charge nurse, I would have to talk to her while circulating, and I'm like asking her questions and she would ignore me. And I would ask several times and she would still ignore me. And so it just got to the point where I had to face the music and say, "Hey, thank you for precepting me, but I've seen that you haven't spoken to me in about a year, so can you let me know why?" And I had to face the hard truth. I had to call a spade, that I was actually being bullied, because I did not want to call a spade at first. I did not want to say that I'm being bullied, but it was a reality. And the reality is, when you come in contact with it, you have to say something. And if you don't say anything, it continues to happen within that system. And then you see people being pushed out all the time. And this same person that I spoke to actually did push several people out. And management knew that she was doing it and they did nothing about it. So we have to start addressing the issue, escalating the issue, and making sure that it's done in appropriate manner. But also that if they need to have a kumbaya, that we need to have a kumbaya. Like, we actually need to have these counselings. We actually need HR involved. We actually need for people to come down to these units and actually counsel, okay? Because it's getting really, really bad. And I'm going to tell you this. These nurses who eat their young, they're going to stay on that unit forever. They're going to drive every one of your new nurses who are inquisitive, who are curious, who are great workers away. And you have to know when to weed out the bad. Not weeding out the bad as in, y'all know my story about in nursing school when my teacher said weed out the bad. But y'all have to know when it's time to start the process, when it's time to start escalating. So let's talk about unteachables. So unteachable simply means that being unable to be taught, right? I had never experienced someone who was unteachable until recently. So I didn't know what it looked like what it actually looked like. And for me, it looked like I don't have as much years of experience as this person, but I have more experience in range than this person. So when I'm trying to teach, it's not being respected because of the years of the lack of years that I've had to them. However, I've had a wide range of specialties as opposed to this other person. And so when it came down to it, as I'm teaching her, she's cutting me off. She don't want to hear what I'm saying. And I'm like, in different worlds, you have to understand what is going on, right? And in the OR, it's very, very important that you know the reasons why, the rationale, the equipment, how to use it, how to plug it in, if you're going to do it appropriately. Know how to anticipate your surgeon, have your surgery ears on. All of these things matter in the surgery world. And when trying to teach that to someone who has experience but not experience in a certain specialty is very hard. And so trying to maneuver someone and egos, it can be a bit hard. So what is an unteachable? Unteachable could be anything, right? Because it's catch-all. It could be fears of asking questions. It could be the prior workplace trauma that's affecting why they are unteachable. The lack of psychological safety. Like, this is a new area for them. So they are afraid to even get out there and do it. They may be burnt out from the last place they were at. But we have to make sure that we're distinguishing between a nurse who's unwilling to learn, which is person who told me she did not want to learn from me, okay? And then a nurse who doesn't feel safe enough to learn, right? And then we have to call out ineffective teaching skills. Teaching through shame, like you're guilting somebody to teach them, or you don't have grace for learning curves. Because I always say, I am not looking for a nurse who has critical thinking skills automatically, especially a new grad and also someone who's transitioning from specialty to specialty. That is not my thing. I'm looking for people who they want to get out there and learn. They want to put their hands on the field. They don't want to put their hands on the field, y'all. It's sterile. But they want to get out there and they want to put themselves to the test. They want to see me do it once, and I'm going to let them do it. I'm going to help them circulate. I'm going to help guide them. I'm going to give them all the tools that they need in order to succeed. And that's my thing. I never want to see a nurse. I never want to see a nurse struggling to understand concepts simply because I am not willing to give them the information. And I've seen that so many times where other nurses will eat their young and they will withhold information, and they don't want to see you successful. They rather see you drown so you can prove your respect to them. And to me, that is not okay. I've seen it so many times. I've seen so many young ladies and young men leave because of that, leave the OR because of that. And I have to say, the OR is a place where it dwells because it's so many people who are trying to take control of the room. Like, this is my room, this is my space, it's mine. No, it's all of ours, because the operating room is a team effort. None of us can work without each other. And that's what people have to understand. But like I said, we have to call out the ineffective teaching styles and that figure it out culture. No, 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 no. I don't want you to have, I'm giving you the tools, baby. I'm giving you the tools. I'm giving you the resources. I'm telling you what you need to know. I don't want you to have to figure it out, because guess what? You're not going to figure it out. You're going to struggle. And even if you figure out a portion of it, you don't know the full scope. So I want to make sure that for our listeners, I want to see, are we actually teaching or just judging, right? And then nursing culture as a whole. Y'all, how did we get in the position that we are in? This is systemic, y'all. This is larger than this. It's way larger than this. It started happening before us, right? People are not addressing the issues. People are not saying the truth. People are afraid to come forth and say what's happening. And systems are often rewarded for these behaviors because it's a facade, right? If you have a unit who's doing well in all of these other areas, but they have poor culture, that administration is going to get rewarded for certain things. And guess what? They don't want to address all of these other things because they're getting rewarded for that. It's based off of survival, not support. We are throwing people to the wolves. They don't feel like they have support. They don't feel like they have people holding them up so that they can learn appropriately. And it's always productivity over people. We're talking budget, budget, budget. Mind you, I'm in my DNP program, so I understand that budget is very, very important. FTEs are very important, but you have to remember that you're always, always, always dealing with people. And people matter, and their emotions matter, and how they feel matters, and it's going to matter to them even if it doesn't matter to you. And so if it matters to them, guess what's going to happen? They're not going to produce appropriately anymore. You're burning out your employees. You're making people feel like they're not worthy, they're feeling like imposters. We are frustrated. We're leaving the bedside. We are tired. And also, people are taking out they frustrations on the wrong people. Stop taking out your frustrations on that new grad who might be making more than you because systemically they just came in at a time where the market value was something and they ended up getting more than you, right? Stop taking out your frustrations on someone who has rised in ranks into management quicker than you did. And honestly, did you really want that management position? Probably not. Stop taking out your frustrations on people that it does not need to be on. And start emailing about your feelings and your emotions to your superior and to HR. Because trust me, this system is bigger than what you are. And if you're going to make a difference, you have to band together with the people on your unit. You got to email. You got to make sure HR is included. Do not be afraid to actually have the conversations, y'all. Y'all got to start having the conversations. Y'all got to start having the tough conversations. Because what ends up happening is we end up being right in the position that we are now. And that's with nurses leaving. That's with nurses going on about their business. That's with people not even coming into nursing because they've heard all the horror stories. And the beautiful thing about nursing is, like I said earlier, the pivot. Y'all, I'm tired. The pivot, the ability to move and shift as you want to. The downside is when you pivot, what are you going to see? What is it going to look like? Because a broken system will always turn coworkers into enemies, right? It is a mess out here in this nursing world. And we have to talk about it. We got to stop. We got to stop sugarcoating it. It's real. It's real. The racism, the discrimination, the prejudice, the people that you're going to come in contact with. How many times have you had to go through this? How many times have you had to go through this? How many times have you been the person to do this to other people? And have you worked through those issues that you have in order to not be that person? Because I want to say this, it takes a lot of self-reflection to make the change in a career field, right? Because a lot of times we think that we're doing the right thing because we're in this career and we've been doing it like this for so long that we don't recognize that we need to make a change. And we might be the ones who need to change, right? Some people don't want to actually think about the fact that they might be the person that need to change, especially if you've been in a toxic system for umpteen years. Some of that toxicity lasts on you. And even if you have somebody being nice to you, you don't even know what that looks like. So you'll sabotage even coworker relationships because of what you've gone through in the past. And that's not okay. A lot of y'all need to go to therapy for the job trauma. We don't talk about job trauma enough, but a lot of people need to go to therapy for their job trauma because it's affecting you in other positions, right? And so we want to make sure that we're talking about why nurses are fleeing the profession. And it always starts at the top, y'all. The little toxicity started at the top and then it drip, 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 drip down to the bottom. And so we want to make sure that we are supporting our nurses, support them, make sure that they feel like they are capable of doing anything. Stop with these hostile work environments. Nobody should have to breathe deep all the way to work. Nobody should have to listen to praise and worship all the way to work just to get through the day. They should be able to say, you know what, I'm going to have a great day at work. Okay. Everybody is human. Everybody is human. Everybody deserves respect. Start respecting people now. If this is you, if you are this person who is wreaking havoc all across the units, all across the USA, you need to start remembering that you are human and they are human, right? Stop always criticizing people. There are things that people need constructive criticism for, and there are things that people deserve a pat on the back for, a thank you for, a good job for, a kudos for, a daisy for. They start being the person that you want to be and start being the change that you want to see, because a lot of people that I've recognized who complain about the system also participate in the detriment of the system, right? They participate in it and it is horrible. I've heard so many people talk about how it's so bad here, the people treat each other bad here, and then you see them replicating the behaviors, and it is not okay. And if it happens to be a unit that you're on and it's that toxicity is just sitting there and it's dripping down, you got to duck and dodge it. And sometimes ducking and dodges means escalating it. And if you see no change, you might need to go. Because I never want you to be someone who is questioning who you are at your core because of what your job has done to you. I never want that to happen to anybody, because culture impacts retention, patient safety, your mental health. I don't want to talk about how many people I know that are on antidepressants just because of what work did to them. Y'all, the amount of people I know who are struggling mentally because of work is shameful. Nobody should ever have to go through the things that we go through in healthcare without support. Without support. Because we need the support, right? We got to make sure we're telling the truth about what's happening here. Because this job is hard. What we go through is hard. Now, y'all don't all have to go through the same thing that we went through, but it is hard, right? And I want our seasoned nurses, I want you to reflect on how you were trained versus how you train, right? Did you really like how you were trained? Did you really like how you were trained? Or did it hurt your feelings? Because, see, a lot of people forget where they came from. A lot of people forget that they were trained by somebody that cared about them, that respected them, and they would rather leave other people to the wolves. A lot of people were trained by nurses who eat their young and turn into nurses who eat their young. How were you trained versus how you train? We need to start reflecting on these things because a lot of nurses ain't going, y'all are not going to therapy about your job trauma. You go into therapy about your life trauma and all of these things, but not your job trauma. Because that really don't exist because it's a job, right? So I want you all to choose mentorship over misery. It's easier to be nice than to be mean. I promise. I promise it's easier to be nice than to be mean every day. To come into work every day mean. Do you know what that does to your coronary arteries? Do you know what that do to your heart chakras? Do you know what that does to you to be mad all the time? Your blood pressure is high. Okay, cholesterol high. Dang, they're about to have an aneurysm because you mad about something. Choose mentorship over misery. And then for leadership, I want you to invest in onboarding and preceptorship. I want y'all to build programs and trainings that allow for people to feel like they are ready to hit the ground running. I want you to address bullying consistently. Stop letting it fly over. Stop saying y'all are adults. Actually address it. When it comes across your table, you address it. You pull those people down and you have the mediation session. Book the mediation session. And then for new nurses, advocate for yourselves. I don't know if y'all have heard my story, but I've had to advocate for myself several times. As a new nurse, as someone who came in and hit the ground running, as someone who came in during the height of the pandemic, I've always had to advocate for myself. And no, it was not easy, but I had to learn my nursing voice. I had to have my nursing voice very early, which taught me to always speak up for myself, even when it's hard, because it's not always easy. I think I make it look easy that I'm speaking up for myself, but it is not easy, y'all. It's not easy. There have been times where I've had to say, okay, Keisha, just go say the thing. There are times when my hands are shaking, my heart is beating fast, and I'm like, Keisha, you got to say the thing. You got to find safe mentors. I have had to fire one mentor. I have had to fire one mentor. I saw that she really wasn't trying to precept me. She was like, "Oh, you're great at your job." And she kind of left me there. And I'm like, I'm struggling. Baby, I'm struggling. And I had to fire her. I simply went to my boss and I said, "Hey, I don't think that she has the time to precept me. Can you find me someone else?" Right? And I'm not able to learn with her. And know when to leave environments that harm you. If you are, y'all, I have a video on my phone right now because I was recording my final days at my other job. And I have a video right now. And I was like, this is the first day that I feel okay going into work. And it was when I put my 2 weeks notice in. Yep, that was the first day that I felt safe going to work. So know when to leave environments that harm you. And then we have to talk about overall. Normalize feedback without fear. We have to make sure we're creating a safe environment for people to actually say what they feel, because creating a fearful environment will lead to your staff not telling you how they feel, will lead to unsafe work environment, will lead to unsafe practices, will always lead to unsafe patient care. Okay? Create the cultures of learning and not punishment. We are teaching, we're having teachable moments. We are reinforcing those teachable moments. We are not making people feel bad because they have made a mistake. And if that mistake was something that needed to be taught and it wasn't taught, we need to actually go to management and say, hey, this needed to be taught. And because this wasn't taught, this mistake happened. And so how can we implement a system in order to decrease this or keep this from happening? All of these things, right? And so I want to make sure that we are reflecting on how we feel going to therapy for work trauma. And also we have to always say, speak up. Don't let anybody make you feel small because you belong, okay? I want you to know that you are wonderful, right? but you also have to say the hard things, so that we can change this system. We got to change this system, y'all. It's too many of us leaving. It's too many. Pretty soon coming to a near you. um, I have seen so many people leave units just because of how they were precepted, and they were wonderful. And one day they felt like they weren't, because they were told that they weren't. See, this nurse bullying thing, it can get really bad. This nurse bullying thing is something that we are not addressing appropriately, and it needs to be addressed appropriately. And you will have bullies out here who will try to get to the manager before you get to them. So they will oftentimes, if they feel like you're going to tell on them, they're trying to go tell on you first. You have to make sure that you're doing what is in the best interest of you, because at the end of the day, if it's not being reported, if it's not being talked about, people will act like they don't know. And if it's not documented, it wasn't done. Unfortunately, that's not just for charting. That's also for these conversations that you're having with your boss about said issues, and you're not emailing to follow up with said issues. You're talking to them in person. They will always deny that you spoke with them. With that being said, I want to say that there's hope for nursing, but we got to talk about the hard truths. You got to be teachable. You got to be receptive. You got to be kind, because kindness is easier than being malicious. You have to recognize what we need in nursing versus what is being given to us. We are always pouring out to other people. Please don't treat anybody else how you were treated and you know you didn't like how you were treated. It's not fair to anybody. And with that being said, this is a heavy episode. So I'm gonna roll up out of here. I'm gonna upload this for tomorrow, and I hope that you all have a great 2026. And always remember, shift the culture, because we need more people like you. We need more people like me. We need more people who actually care. Okay. With that being said, if nursing is gonna survive, the culture has to evolve. It gotta evolve. I'm tired. I'll talk to y'all later. Bye.